So we're both in frame. That's kind of cool.
Yep.
Oh, we have a little bit more space now. And we're live.
We're live. We're live on Facebook.
Yeah, we're going to turn.
And live on Audacity.
Yep.
All right.
Everything seems to be working.
12:30.
We can drop
Drop the mic.
Yeah, actually that's perfect.
All
right.
Mine lower or no?
No, I think no, look at that.
Okay.
If you speak again.
Does mine need to be lower? Maybe.
Yeah, hold it. Wait. Yeah,
Whoa.
It's got a little. Okay, that looks good.
Okay. All new experiences.
Great news. Nobody's watching yet. Yeah,
Good.
so that's
Okay.
good. Okay, so hi, I'm Dr. Russell Lomdieu, and I am here with Dr. Caroline Hartridge, who is a doctor of osteopathy, so a DO.
A DO.
And tell us quickly, what is a DO and how is it different than an MD? I'm a DPT, so I'm not really even in the medical doctor world. You kind of are. It's a little different. So
It
tell
is
me
a little
about that.
different. So in the U.S., we have two types of fully licensed physicians. One is considered an allopathic physician, and that's your MD. And then there's an osteopathic physician, your doctor of osteopathy, a DO.
Okay.
We both attend medical school. We both have to go through boards and licensing exams. However, the osteopathic medical student has a few tenets that guide them through the curriculum.
Okay.
And then we actually learn an additional skill set.
Okay, and what
So-
would that be, that additional skill set?
We learn to diagnose and treat with our hands.
Really? With your hands?
With our hands.
And
So-
your ears, too?
With our ears, we learn to listen to the entire patient. So kind of the tenets of osteopathy, osteopathic medicine, is one that you are a mind, body, spirit, and I
Okay.
can't take those three pieces apart.
Okay. Good quality to have in a physician who our medical doctors are sort of trained to literally ignore those things. They don't take them apart. They just refuse to believe the spirit even exists is part of the equation.
Well, and we can consider spirit, energy. I mean, if we want to just keep it to science and math, you have an electronic communication going through your heart.
Yeah.
Right?
Right.
So, and we know from physics that 90 degrees to any field of electricity, there's an electromagnetic field.
Correct.
So we know you have an electromagnetic field.
Right. By virtue of the
Which is
fact that we can
energy.
measure the electricity in your heart. For those of
Right.
you who've ever had an EKG or seen an EKG, you know that that's measuring electrical activity. And what Dr. Hartridge is saying is that there is an associated magnetic field with that electricity. So there's no guessing about this.
No, so even if you don't want to have the spiritual
Like the whole chakra
conversation,
thing, right? Yeah.
then we can keep it to you are a physical form, you are thoughts, and you are an energetic form.
Okay. So if you want to really just keep it to that sort
just
of mainstream science.
Science, fine. It's still the same concept. The other one is that your structure and function are interrelated.
Okay.
Fairly basic.
Yeah,
I think
yeah,
everyone
and
can get
that's-
on board with that one.
That's big time embedded in my training as well, obviously.
And then the other is that you are self-healing down to the cellular mechanism. And we know this mostly as homeostasis.
Right.
And again, that's a pretty hard one to argue with.
Right, and homeostasis, for those who may not be familiar with the term, is this tendency of the body to seek some sort of normal level. So no matter what happens in the body is going to try to seek its level.
Right,
its
and we can
normal
consider
level.
that self-healing.
Yeah, oh, absolutely. And the human body has an amazing capacity to do this, by the way.
And then the last tenet of osteopathic medicine is that rational treatment takes the previous three statements into consideration. So as we were speaking earlier, we know osteopaths who are interventional cardiologists,
Right.
who are trauma surgeons.
Sure.
I firmly believe they still carry all of those tenets, and they're applying them in different ways.
Okay.
But the trauma surgeon pays attention to how the fascia is coming together and if she can help relieve any accumulation of scar tissue after the fact. So she's paying attention to her ability to palpate all those different levels of tissue during the trauma, during the repair, and during the healing process.
Well, and I have to be honest with you, in my experience, I could always tell the difference between a physician, a surgeon that paid attention to the fascia during surgery and those who followed the traditional sort of Western model of just, it's garbage, just throw it away. And that's the way medical doctors were trained for years and years and years, that the fascia was not important, it didn't matter, it was just that kind of cellophane covering over everything. But when a physician, a surgeon pays attention to it, the scarring is much less, the rehab is much easier, the mobility is much greater, the strength is much greater. So, that difference in philosophy really does carry through to a difference in the way the patient responds to treatment. So we like osteopaths, physical therapists, love osteopaths. They do a great job for us, and we hope we do a great job for you guys
Absolutely.
as well.
No, we're all in it together. It's teamwork.
Yeah, yeah.
And I certainly consider many different providers as part of what helps keep my patients out of my office.
Yeah, absolutely. And so, our job is to just get people better so they don't have to come to us. And it's kind of an interesting thing. And from a business model, our whole business model is to put ourselves out of business.
Absolutely. I'd love to do that.
Yeah, we'd be
Move to
very...
Costa Rica. I'll paint and make buckwheat pillows.
Yeah, there we go.
Painting
Perfect.
into fabric.
Let's talk a little bit about drugs.
Okay.
Because osteopaths do prescribe.
I do.
And for me, I've always considered food a drug.
Certainly.
And I think it is probably the most abused drug that we have in this country right now. So for those of you who are following the standard American diet, please understand that you're probably engaging in drug abuse. So
Well, and I think we were speaking about drug. Certainly there are medical components of food, of whole foods. Of plants. It becomes a drug when we're using it to relieve a symptom.
Okay.
So back to the difference between allopath and osteopath.
Sure.
Induce a symptom to treat a symptom. That's traditional medical model.
So help me understand, induce a symptom to treat a symptom. Yeah.
I'm inducing hypotension,
Low blood pressure.
low blood pressure, by opening up your blood vessels,
Okay.
by affecting the receptors on the smooth muscle around your blood vessels.
So this is what the drug is doing. I'm trying to give you low blood pressure in
To
response
combat
to
your
high
high blood pressure, rather than clean out the extra resistance inside the pipe
the goop,
to reduce the pressure.
which we could do through diet. And it's interesting to me. I think my definition of a drug may be a little bit broader than yours in that it is any substance that is taken into the body and achieves a physiological effect.
Sure.
So it's not necessarily about disease or more of an ease or dis-ease state. It's about if you eat the right food, it is doing what it's supposed to do. It's having the desired, if not designed, physiological effect on our body. And you brought up an interesting point about sort of, let's take away that stiffness in the artery in the first place, and we're starting to learn that food, specifically a certain kind of food, can do that.
We have seen imaging that shows that a low-fat, plant-based diet can actually clear out the plaques accumulated and long-standing cardiovascular disease.
So wait a minute. Now, when I went to school, which was uncomfortably long ago, when I went to school, it was all about coronary artery bypass graft, and then, of course, then we had angioplasties, and then stents came in, and then we found out that when you put a stent in, it actually causes more plaque to build up because it actually roughens the surface inside the artery. So it turns out that all these cutting-edge treatments don't actually solve the problem; they just buy people time.
They buy some people some time. The stenting, for example, doesn't prolong life. It might improve quality of life for some people, but it's not going to change the type of events because the behavior's rarely changed.
The behaviors. So it turns out that is also a drug, that what you do. So the concept of exercise and the concept of stopping smoking and the concept of eating well, which is something else I want to talk to you about. What impressed me is that, I've studied a lot of behavior change, and there is a man out of Harvard by the name of Robert Keegan that wrote a book called Immunity to Change. And he cites a statistic in the book that blew me away. If 7 people are told they will die unless they change critical behaviors like quitting smoking, eating better, exercising.
Right.
If 7 people are told they will die, no question, like given a date, you will die in 3 months, only 1 in 7 make the change. 1 in 7. So it's a 2-part problem. Number 1 is knowing what to do, and there's more than enough confusion out there, by the way. We know that. And number 2 is actually doing it.
Right.
And in my work, a lot of getting people to do what they should do is to sort of install that belief that it's actually good for them. It actually will work.
Yeah.
It'll be effective. And now we have science showing that and I want to just be very clear here,
Yeah.
because nobody knows what it is to eat healthy. Your doctor says eat healthy, and you're like, okay, I'm going to eat healthy, so I'm going to eat plenty of eggs, milk, and cheese, and fish, and whatever it is, right?
That's what I genuinely believe they're coming from. They're telling you what they think is best,
or they don't tell you at all. Here's the part that gets me: you need to eat healthier, and then that's it. The conversation kind of ends there, and then the patient walks out and goes, all right, starting right now, I'm gonna eat healthier. So they go to the grocery store and they go to the healthy section.
Right, and then it's all packaged, very processed food. So
very processed
easy
food.
Answer to that, because it can be quite complicated, or people find me after they've tried all these other things. Mm-hmm. It's simple. It's whole identifiable foods from the earth.
Whole identifiable
foods from the earth. So, I recently had a conversation about how do you feel about coconut oil, Dr. Hartridge? I have coconut oil in my kitchen and in my bathroom. I also have remarkable cholesterol profile. And I feel good about my physical form. I'm able to be as active as I want in my life.
Right.
I found that baseline, and now I am comfortable introducing whole fats or foods or not. So how much avocado I have, how many olives I have, how many coconut. That's better than the processed food.
Okay, wait. So let me just back up a second. Mm-hmm. What I heard you say was somebody asked you about coconut oil.
Right.
And I think the reason that you started that conversation is when we talk about whole plant foods, oils, sugars, and anything in a package that has more than 5 ingredients can be quite accurately considered a whole, a processed food.
It's processed, yes. It's not not whole.
And I think
if it's got a label.
Usually one of the things that I like to use is a line from Michael Pollan's book, Food Rules. Great book, by the way, Food Rules. He has 125 statements that he'd collected over the years, and one of them is, if you can imagine it growing in nature, then it's probably food. Mm-hmm. So I want everybody to imagine that little Twinkie tulip out there and realize, hey, that's not going to grow in nature. So step one is, does it grow in nature?
Right.
Coconuts grow in nature.
Grow in nature.
Coconut oil, you can't even really open up a coconut and get the oil out.
Unless you take the coconut flesh, you dehydrate it a little, you're pulsing it, you're getting into a
Sounds
paste.
like a process. That's a processed food. So here's the problem with processed foods, even when they're processed entirely from a single plant-based ingredient. It's taking all of something from that food and concentrating it into an amount of food that no ordinary human being would ever be able to eat had they eaten.
Had I eaten all those coconuts that's in that 1 tablespoon of oil,
you would have gotten sick.
And I would have been at it all day.
Yeah. So if you're willing to commit to eating coconuts all day long, then that 1 tablespoon of coconut will get to you. But as coconut oil will get to you. But as a rule, we're very cautious about introducing oils into our diet, and that's directly counter to the healthy eating industry, especially like the coconut oil industry. And that's not to say they're evil. Olive oil is probably the biggest culprit here, because somebody misinterpreted the Mediterranean diet at one point, which was the standard American diet with olive oil poured all over it. I mean, the first time I saw an olive oil bar, like a place where you would go and get olive oil on tap, I was like, who does this? I don't. It's considered healthy, but it's not.
And I have plant-based patients who have been plant pure, from how they can understand it, for a few years, and they're still not quite where they want to be on their cholesterol profile. So I invite a food log.
There you go, and that's a big deal. If you're struggling to lose weight, or if you're having health issues,
honest food log.
Oh, that, yeah. Now remember, the quality of your life is determined by the quality of the questions you're willing to ask yourself, multiplied by the times that you're willing to ask them per day, raised to the power of the integrity of those answers. In other words, the food log is your ability to ask yourself, what am I eating right now? Be honest. And it's going to tell you a lot. It's going to tell you a lot about your health problems that you're having, and it's going to tell you a lot about whether you want to lose weight or...
Well, and the solutions.
Solutions.
So maybe it's as easy as, you think, a few tablespoons of oil here and there. That might be what's keeping you from the desired cholesterol profile, from getting off the medicine you don't want to be on,
Yeah.
or from, embracing a little vanity in your life and really wanting to be a certain size or fit into a certain pair of clothing or whatever it is.
Right.
And so it's good to be honest about how many of those processed oils you're having.
No, I agree. I agree entirely. And I think the concept that people miss is that a little bit adds up. A little bit won't hurt, or, one Twinkie, but
we suck at moderation.
Yeah, we're really bad at it. And that's the other thing about the food log is that we don't necessarily recommend that you weigh and measure everything.
I don't.
But please be aware that when you do write down your food, you're probably going to misguess by anywhere between 30 and 50%.
And I'm way less interested, honestly, in volume for a lot of these things than this, if you have it.
Yeah.
Is it even in there? You
so we can have a conversation about it.
Right.
Exactly.
And I think we've gotten kind of into a lot of detail to answer your two questions, because people want to say, it's so complicated, I'm at the doctor, how do I do this, eat healthy? Whole identifiable foods, 1.
Yeah, so...
Minimal processed, low fat. There's
2.
enough energy in a nut or a seed to grow a tree.
So there's enough energy in a nut or a seed to grow your belly, too. Just saying.
So handfuls of nuts and seeds are dense sources of energy. Please be aware of that.
We don't like to use the word calories, but we're going to use them just for you, or the two of you.
And then I think the other topic, so that's kind of a 1A,
So let's
1B.
just back up. I just want to make sure this is absolutely clear. When people say eat healthy, whether they know it or not, our definition of eat healthy, the science is pointing to this as the definition of healthy. We're not making
a summary of the most up-to-date evidence-based literature out there is the simplest way to say it: whole identifiable foods from the earth.
Plants. We're talking about plants. Okay, better that it's growing out of the earth than walking along it. Okay, so whole plant foods, minimal processing, and processing includes refined oils of any kind and sugars.
And then a low fat too, because we could be a whole avocado eaten, still not getting the results I want. So
and that's
a low intake of high fatty foods, including the avocado, the oil, the olives, the nuts and seeds.
So in our work, we talk about that as calorie density. So you said energy density, which is probably a more accurate term, but we're going to use the word calorie because I think people understand it. Is that I want you to imagine a salad with salad dressing on it. Okay, it's an oil and vinegar salad dressing. So it's oil, which has 9 calories per gram, and then salad, which has 1 calorie per gram. And I want you to imagine accidentally eating 200 calories of lettuce. I want you to imagine what that would be like. That'd be like 5 bowls of lettuce, maybe 10 bowls of lettuce, okay? And I want you to imagine accidentally eating 200 calories of salad dressing. So now you have 400 calories instead of 200. That's another tablespoon. So see the difference? If you're
It's a slippery slope.
It's a slippery slope. So
stick with your vinegar, stick with your lemons.
We make a great salad dressing out of a hummus base. So we start with the hummus, and then we add vinegar and then aquafaba to it. And it makes a beautiful salad dressing, and there's no oil. So it's really, really important that we try to stay away from those oils, mainly because of A, they're not healthy, and B, they will pack the pounds on because of the calorie density involved. Okay.
So, and then the other part that I think we continue to touch on is just, it might be overwhelming, and these might be a lot of changes you're being told are opportunities for you. But in each moment, it's really about personal responsibility. Did you put it in your cart? Did you put it on your plate? Did you put it on your fork? And did you complete the intimate process of choosing to make it part of self?
Interesting. Yeah,
and
personal
all
responsibility.
of those are options and times to make choices that really reflect our own personal responsibility. Am I giving the power up to fast food to determine my health? No.
And that is a really relevant topic to sort of evolve into, this idea of personal responsibility. The food we eat is a personal choice. It is a matter of personal responsibility, and we do very often give up the power of our health to the food we eat. And we very often look for someone else to solve those problems, and that's it seems like that's what physicians in the medical community have become. It's sort of like fix me.
Right.
And I know when I had a very, very busy practice, the fix me people were the hardest for me to deal with, because what I wanted to see for people to alleviate their suffering was for them to really invest in their own health.
Mm-hmm.
And that's the only way you become sustainably healed. We don't use the word cured in our business. We use healed, which means to become whole. So imagine this. This whole process of figuring yourself out might be a large part of why we're even here on this planet.
Right.
It might be a large part of how to become whole or healed. And engaging in the process of figuring out your stuff includes figuring out why your back hurts or your neck hurts, and exploring those positions and exploring those movements, rather than just kind of sitting there stiff and going, oh, just fix me, give me a drug or another whatever, right? And do you have that experience with your patients?
Oh, for sure. I mean, from the mind-body component to the low back component to, I really would like just a pill to lose weight. And I know it's my thyroid, so help me. And I'll engage in that conversation with you. Let's start with your thyroid panel and an ultrasound. Oh, they look pretty well controlled. What else could be going on?
Sure.
And that's where we have the option
start
to go into.
Start that food journal. Let's see.
And then I ask them to treat it like an experiment, a scientific experiment, the same way we would start a statin or your thyroid and then recheck your labs.
Right.
So go for a whole food plant-based diet. Let's be strict about it. Let's be honest about it. Let's try it for 10 days.
Probably honest is the best word to use. Be honest about it. Strict is so hard because your brain starts to turn off, but I love that. Be honest. And imagine this. If you were to go on a 30-day plant-based diet, you have nothing to lose. Well, except for weight. And maybe that heart disease that's been kind of hanging around.
It's cheaper.
It's that, people think that it's more expensive, but it really isn't.
And you know what? You don't have the food coma. Food coma, it can be quite a few things, but I would invite anyone to hop on YouTube and search capillary blood flow after fatty meal.
Yeah.
Such a good video. So
I like that. Yeah, do that. It'll freak you out.
And so you can see all of these single blood vessels down to the capillary, and you've got all these little red blood cells, and it's so small they're lined up one at a time. Just
trying to push through there like a subway at rush hour. And so your body's just like, you wonder why you're sluggish. And
you're not getting the oxygen delivery that's in the middle of each of those little red blood cells to the area you need. And so you're sluggish. You've got a bit of brain fog. And so even if you give it 30 days, I imagine you'll have reduced brain fog, increased activity, and as we can clear out some of the gook inside the blood pipes, we have improved blood flow to all the important areas, including brain and peripheral extremities. We can leave it at that.
All of your peripheral extremities, guys. All of them. Just saying.
So
you don't need that Viagra stuff.
You don't. I have patients who are 70, 90, 100, and are capable of expressing everything they want to in their life through a plant-based diet without the help of pharmaceuticals.
It sounds like we're really hyping something up here. And we're not. Okay, we're not. Karen and I run Harvest Food Box, and Harvest Food Box, quote unquote, sponsors this podcast. We did not go into that business to sell food. We had no intention of selling food. I never wanted to sell food ever since I left the ice cream business as a 410-pound ice cream man. I saw the light. I don't want to be in the food business anymore. But I really have this desire to heal. And what I learned is that this is the best way to heal people.
It is.
So,
and you've healed yourself. I've healed myself through this.
Absolutely.
Osteopathy helped me heal in a whole different way from other things. And I thought it was good to go. And I continue to have low back abdominal pain.
Okay.
And I'd done my mind-body work.
Okay.
And I'd eliminated meat, fish, crab, eggs. Okay. And I was down to a little bit of butter and cheese per week.
Okay.
In and out of the hospital with horrible abdominal and low back pain. Turns out I had endometriosis.
Okay.
Which, if you don't know, this is uterine tissue that's in the abdominal cavity going through menstrual cycles. So it's very uncomfortable.
No idea what it might feel like, but it sounds awful.
Horrible. And I've got a great pain threshold. I've had child at home without any pain meds. I've had sutures without any numbing agent.
Badass.
This hurt. This stuff hurt. So I actually signed up for an ablation.
Okay.
Where they go in and burn out all that tissue
Yep,
at Stanford.
yep.
And I don't really believe in elective surgery for myself in that.
Sure, I understand.
So I was prepared to do this. My quality of life was not that great. And it was beginning of fourth year medical school, and I went to do a live-in wellness program with Dr. McDougall.
Oh, love Dr. McDougall. We've interviewed him on this podcast. Super guy.
He invites medical students to participate for free in something that other physicians have to leave their practice and pay to come and learn about. So it's an incredible opportunity.
Another reason we love good old Dr. John McDougall.
And he's out there to help people. He's made all the money he needs out this. He's really trying to share a message he believes is a fundamental truth.
Yeah, his weekend intensives are incredibly reasonably priced and definitely worth the trip.
Everything. So 3 days in, I figured I'd do it. I was there. It was free food.
Right. Oh, yeah.
And I thought I was pretty darn healthy. 3 days in, I called Stanford and canceled my surgery.
Wow. The results are pretty impressive.
And they're quick.
But you have to be, honest about it. And that's the other problem people have. I've had clients who tell me, oh, we're doing it, but they're not getting any results. And then finally, all of a sudden, they start to get results. I said, what happened? I said, well,
we actually did
finally started to do what you told us to do. We're like, oh my gosh! So you've been coming here for months, paying me all this money?
We're all in our own process. We're all in our own timeline. And you don't get it till you get it.
Yeah. And then one day it just clicks and everything goes
and it's really easy, and I don't feel deprived. I would never go back. And now, if I am near all those other foods, and I never thought I'd be that person, it's like it's almost repellent to myself. I don't want that to be part of self anymore.
I've noticed that with me as well. I don't crave bacon. I don't crave meat. I don't crave dairy. As a matter of fact, if I'm driving past a restaurant and I smell it, it was like, oh my God, this is awful. And it's an interesting reaction for somebody who, I was 410 pounds. You don't get that way by hating fried food. You don't get that way by hating bacon, okay? I was a food addict, okay? I couldn't imagine myself not having these things in my life. And I couldn't imagine not being 410 pounds either. But once I was able to imagine a whole new way of being, then I was able to get everything. What is it, that term, everything in a bag of chips?
Yeah.
I get everything, but not the chips, they're fried. So anyway, I think we've been chatting for about a half an hour now, which is kind of where we wanted to be. I would like you to tell us a little bit about exactly what you do and where people can find you, and what sort of things you offer.
All right.
And you might want to do that as a direct camera shot so people can see your face.
Hello. So I am Dr. Hartridge, and I have a website, and drhartridge.com, drhartridge.com. So you can find me there. You can contact me there. I work on Long Island as a primary care provider, so I can do all of your basic family medicine needs. And then I also focus my practice on osteopathic manipulation, where I diagnose and treat with my hands, plant-based nutrition, and I'm also a medical marijuana provider. So I offer all of those things from Manhattan to Montauk. And I work out of an office in Brookhaven, and then I'm also happy to make house calls.
And you also have an Airbnb that you can do live-in intensives?
So, yeah, my website explores different live-in wellness experiences. There's one at my home. There's an opportunity in Georgia, Costa Rica, and Four Seasons Resorts.
Yeah, that sounds pretty cool, right?
So if you'd like to dig into your dis-ease and release the manifestation of your dis-ease, I'm Dr. Hartridge, and I'm here to help.
Well, thank you very much for listening.
Thank you.